This is the Etiology podcast. I am your host, Elka Kubaku, licensed social worker and psychotherapist. In this podcast, we explore divisive issues around food, health, and body image with the goal of mending relationships within the eating disorder recovery professional community and creating a space where a multiplicity of perspectives can coexist harmoniously. This podcast is uncensored and encompasses the political and ideological spectrum. If you believe something you hear is harmful or misinformed, please be respectful to the speaker. And also, feel free to reach out about recording another episode on the same topic from your vantage point. My hope is that if, as professionals, we can hold each other's stories with respect and compassion, we'll be better able to do so for our clients. In eating disorder treatment, meal plan compliance is often used as the objective measure of safety and recovery, which then determines readiness to step down to lower levels of care. It follows that meal plan noncompliance is assumed to be a form of treatment resistance. The reality, however, is that meal plan noncompliance is not always a sign of resistance, but can also indicate a mismatch between the meal plan and the unique characteristics of the person who's prescribed it. In this episode, registered dietitian Brenna Veles discusses how traditional eating disorder recovery expectations often fail to acknowledge the unique ways people on the autism spectrum experience the world. She explores how sensory sensitivities and differences in black and white versus nuanced thought processes can affect recovery. Brenna shares her personal experiences and professional insights on creating environments that foster true healing rather than encouraging masking and conformity. Brenna is a registered dietitian with advanced training in treating eating disorders through the International Association of Eating Disorder Professionals, IADEP. She works with clients to manage nutrition concerns that arise with ADHD, autism, anxiety, PTSD, depression, and eating disorders, whether these are physiological, like nutrient deficiencies or high or low blood pressure, or psychological, like guilt and anxiety. As someone who is herself autistic, ADHD, and queer, Brenna is deeply connected to her work. She regularly attends neurodiversity and anti-racist trainings to ensure a healing space for all clients. Brenna currently practices in Texas and Wisconsin with plans to expand to more Midwest states and is accepting new clients. She can be found on her website, Bread and Butter Nutrition Therapy, which I will link in the show notes. Hi, Brenna. Thanks so much for joining me today.
Thank you. I'm very excited to be here and say my piece and say what's on my mind 24/7, 365 days of the week,
Awesome.
of the year,
That'll be
whatever.
great. Yeah, however many days of the week and year, I'm sort of with you on that right now. So you wanted to talk about neurodivergence or autism and how it isn't accommodated in eating disorder
Mhm.
treatment, how you work with it and would like to see it accommodated. Can you tell me a little bit about what you've encountered being in the field and why this feels so important to talk about?
Yeah, so I started my eating disorder treatment part of my my professional eating disorder treatment part of my life
Mm,
in 28. When did I graduate college? 2017 at a residential treatment center for adolescents.
mm,
Um, and this was before I was fully identified as autistic. Um,
mm,
there was some questioning of hey, maybe is this going on in my brain? But it was it was not a definite thing that was on my radar at all. And right off the bat, I was like, this is weird. This doesn't make sense to me. There's things that just are not vibing with me. Um, but I was brand new, so I was like, okay, I just chalked it up to I don't
mm,
know yet, and I was there to learn. Um, so I learned, and then I brought that experience into my first kind of 3 years of being a dietitian, where I was trained through IADEP, very much kind of that your typical eating disorder training. I had gone all the way up to where I was about to submit my my certification for SEDS. And then I took a
Mm,
step back and I was like, is this like, am I treating people or am
mm,
I helping people heal? And I was
mm,
like, how at that point I had been in my private practice for a little bit and I was like, what feels right? And
mhm,
the answer was not going forward with these like more traditional eating disorder treatment things. That doesn't mean that I don't use evidence-based practice. Like I definitely use everything that I was taught through IADA,
mhm,
and they're taught with the like understanding that somebody is neurotypical.
mhm.
Like we go into sessions thinking like this person is not autistic, and in my case, not true. Um,
Yeah,
yeah,
yeah. I love that statement you said, but I already forgot it. Am I treating people or am I helping people get well? Was that it?
yeah. Am I treating people or am I helping people heal?
Am I helping people?
Because I don't think it's my job to like I'm not going to heal anybody, right? Like that's not, no one's coming to me for like blessings or whatever. Like they're coming to me for support for their own healing journey, whatever that definition of healing means to them at that point in time in their life. Um,
Mhm.
yeah. And I'm
Yeah.
like, am I just checking things off of a list of like, yes, this person ate breakfast, lunch, and dinner, or is it like they are truly nourishing their body, whatever that looks like for them?
Yeah. I hear a value for almost like a more wholesome approach that doesn't just look at predefined behaviors and also one that centers the client. Like I'll work with you, I'll follow you.
Mhm. Yeah. And I think my thing too is like with the DSM, like I guess like again, the going back to the core value, like core beliefs, like this was all made out of like trees and mountains and airs and dust. Like why are we saying that the DSM is 100% truthful 100% all the
Mhm.
time? Why is that like 100% authentic when I don't think it necessarily is, you know, like,
Yeah.
that wasn't like bestowed upon us like that. It's a book.
Yeah, it's a book. And it's actually really interesting to read about how it was developed. Totally
Yeah,
different conversation, but definitely takes away some of the almost like biblical authority. But it's different
exactly.
when you look at that process.
Exactly.
Tell me more about, so you're working in a treatment center for
Mhm.
the first time. You hear a lot of things that sort of don't fit or don't feel quite right. What were some of those things that were part of eating
Yeah.
disorder
And I
treatment?
mean, I think even just with like what I was told to do, like I was a diet tech at the time.
Mm,
Um, and I remember there was one time of like, they were like, it's supposed to like mimic a home environment. Like we're supposed to be very chill, but also they're like set the timer for 10 minutes and of supplementing, but also like have normal conversations. And I'm like, it felt very like I had to switch back and forth between like trying to be chill and then like trying to be professional. And I was like, I don't, it
mhm,
just, it felt very weird. Um, and then there was one time like they were having pizza and I was like, I never ate the crust on my pizza. I still don't. It's dry and it's gross and disgusting. Um, and I'm like, what if they don't eat the crust on their pizza? Like, I feel like that's a very normal kid
mhm,
adolescent thing to do, is not eat the crust on your pizza. And the dietitian was like, oh, just dip it in ranch. And I'm like, okay, but then that's technically another fat on their meal plan. Like, do we add that in? Do they decide before, after? And she's like, no, it can just be like a chill thing to dip it in ranch. And I'm like, but then we still have these rigid meal plans. Like, it just felt very weird to me. And I feel like there's a misconception that like autistic people are black and white in the way that it's either
mhm,
like all or nothing. When I
mhm,
think a more accurate description for me and a lot of people is it's either not nuanced at all or very, very, very nuanced. And
mhm.
we get stuck in this binary of like, I can't like, okay, is this a black and white rule or are we like really nuancing this? And if it's nuanced, like, okay, how, one more drop of ranch, like what is that? What does that look like? We can go with that all day long. So it felt very weird to me to be in this spot of like make food normal, but also food is extremely rigid. It felt
Yeah,
weird. Yeah.
you were navigating this divide that was like, okay, we want to be comfortable, we want to be normal, and there's a timer set at meal times and very specific amounts and foods that people need to be eating.
Yeah, yeah, exactly. And I feel like that's what is a big complaint in eating disorder treatment is that it's not, or is that it's too rigid. Like it feels very weird. But then at the same time, the gold standard for eating disorders is like a rigid meal plan or a structured meal plan or kind of whatever label we want to put on that. But it's having a lot of structure around food, despite that also being part of the eating disorder. Um,
Mm-hmm.
yeah, I don't
Yeah,
have the answers, but it's just weird.
it does feel like an interesting, and I can see like, so we're at this place in eating disorder treatment where we're like, on the one hand, we want to be, or ideally, we want to learn how to trust our bodies again. We want to get in
Mhm.
touch with our bodies. We've learned to shut them down, shame them in so many different ways. And on the other hand, we're at a space where it's like, if I'm just uh, not not eating enough or eating in ways that are very chaotic, it's almost like we want to put some sort of external structure that gives us clarity on like what what are we doing here? What is going to help this person's body get back to health? So it
Right.
feels almost like an inherent contradiction.
Yeah, yeah. And I mean, I still love me some structured meal plans. And I think especially when we're working with autistics, like the millions of questions that you get whenever you say, "Hey, here's your meal plan," or "What do you think about your meal plan?" or whatever, it's not 100% of the time the eating disorder. Like those
Mm-hmm.
might be very legitimate questions of like, okay, when you say a squirt of ranch, like what does that mean? Like that is a broad definition when you're coming at it from like a autistic brain spectrum. Sorry, my dog is chewing on the cat food can. I need to go grab her before she cuts her mouth open. Hold on one moment. I was like, what's that clanking? What a weird truck. Oh, never mind. That's my dog. That's my business. That one's
Yeah,
mine.
she's safe now.
She's good. She
Okay.
stole it from the trash. She was like, she wanted a little snack. She was just cleaning up, making sure it was ready for recycling.
Yeah. Okay.
Okay, where were we at?
Yeah. So one challenge that you encountered was just this like interesting combination of rigidity and trying to make it all seem normal.
Hmm.
And uh, that felt difficult to hold where you're describing it where it's like either either be fully nuanced or be fully black and white, but trying to have it both ways just feels confusing, feels like self-contradictory.
Yeah, yeah, exactly.
And then when you talk about the pizza crust, for example, was there an aspect of that also, of like sensory sensitivity, how different people just tolerate and enjoy different foods?
Hmm.
Was that part of
Yeah,
that as
yeah. I think having, and I have like other client experiences with this as well, but like telling people like, no, it's disordered to not eat your pizza crust. Like even if you don't like it, like you can still do it. But
well?
like for me, pizza crust is disgusting. Why would I ever waste my time on that? Unless I'm dipping it in some like garlic butter. Like then we're chill, we're good. Um, but
Yeah.
even that like nasty little like bit on the back, not happening. But like telling them like, oh, it's just your eating disorder, ignore it. And I mean, if somebody was like saying, eat this pizza crust or you can't go home in 2 weeks, I would eat the pizza crust. But what
Mm,
that would do is just further deteriorate that me listening to my own body. And so when we are saying listen to your body so that you can heal from your eating disorder, but also just eat the damn pizza crust, it's like, okay, me and pizza
mm,
crust aren't vibing. So it would be just diminishing my own personal type of intuitive eating to eat it
mhm.
anyways. And then
Yeah.
again, we're like contradicting our statements.
Yeah. So if you're like, okay, just override what you're feeling, eat the pizza crust, you're learning essentially follow external rules and ignore yourself.
Exactly, exactly. Which is a lot like diet culture. That's,
Mhm.
yeah.
How does that, one thing I've definitely encountered, like being an intern working at a IOP program, that perspective and seeing where it comes in. But what I will often have people, even now, who will be like, I feel I feel really nauseous when I eat. And I've been avoiding eating because of that. And we will work on like, okay, can we feel that nausea? Can we let it be here? And also still eat.
Mhm.
How do you navigate those two like yes, like when we're or when someone is recovering from an eating disorder, oftentimes their bodies and mind are giving them distorted signals, and at the same time, we want to be respectful of what is their way of eating and what feels okay for them. How do you navigate that?
Yeah, I think that I mean like even in outpatient world, like we're very quick, we're very scared to give room for the eating disorder. And that's one
Mm-hmm,
thing that I hear like a lot of my like colleagues and stuff talk about is like, well, how do I know it's the neurodivergence? Like, how can I be sure that that is not the eating disorder? And I'm like, they've worst case scenario is that we give a little bit of room for that feeling
mm-hmm,
to come out and for us to ponder what it is.
mm-hmm,
You know, like I feel like it's not necessarily up to me to say that's your eating disorder, it's not your eating disorder. Like in I mean, sometimes for like time's sake, I'm like, okay, girly pop. Like I think that that's your eating
mm-hmm,
disorder talking. Um, but in an ideal world with all the time in the world, I would allow the client to make that statement.
yeah.
But I don't think it's necessarily a counterintuitive to treatment to just discuss that feeling more and talk about like where do they
Mm-hmm,
think it's coming from? Like what would it be like to either A, still eat through the nausea? Like what experiences have they
right.
had with that before? And also I think as a dietitian, just like looking back of like, are you getting nauseous because you're waiting way too long to eat? Like, do you need to eat more
Mm-hmm,
frequently? Do we need to have a little like
mm-hmm,
like have a little applesauce before lunch or drink a little juice or whatever to kind of get that blood sugar up so that we're not going into that meal so hungry. Um, so still using that food science and neurochemistry, but
mm-hmm,
believing the client when they say they're nauseous and not just automatically jumping to that's your eating disorder.
mm-hmm. Yeah. So you're believing the client like and working together with them where they're able to challenge themselves and where they feel like it would be beneficial to challenge themselves.
Hmm. Exactly. Like if they're,
Mhm.
if the ground is really that tough there and they're like, no, I'm way too nauseous for meals, and it's like, okay, let's is snacks going to be easier? We're not just going to
Yeah.
dig into them. And also I have my private practice, like, and I'm an outpatient, so I can have the freedom to make things make
Hmm.
things very applicable to the particular client.
Right. In treatment centers, that's a lot
Hmm.
more difficult. They tend to be a lot more rigid, both in terms of it being a larger system that has to have like some sort of guidelines and procedures, and it's like harder to break those. And also because there's a social component.
Hmm. Hmm.
Yeah. I'm thinking about also like something that I've thought about before. I've heard the term a lot before, also like colluding with the eating disorder. Sometimes in ways that felt dismissive of the person to me. And sometimes I think about like, and there's space for both of these, but there's like one perspective where it's like eating disorder is the enemy. We need to recognize it whenever it shows up and like systematically push it away. And I've seen that and used that a little bit in my own recovery. And alongside that, and maybe this is further down the line, there's like, it feels like there's also space to see the eating disorder or like almost befriend the eating disorder, not in a way of like, I need to do whatever my eating disorder is telling me, but try to, I can try to understand it. I can speak to it. I can negotiate with it.
Hmm. Yeah, and I think too, like asking what the eating disorder is telling you, particularly for like us autistic people, the eating disorder can and is very protective. Um,
Hmm.
so if I can give my like own fun little personal story, um, I don't know, like recall it from my brain. Um, Having to like switch personal to professional now or professional to personal now. Um, so in high school, I was very autistic, but highly masking, right? And by very autistic, I just mean the signs were there, but I was extremely highly masking.
Yeah.
And so when it came around to lunchtime, as the day went on, I had already collected so many things that I did that would make me different than my peers. I couldn't
Hmm.
let food be one more thing. And food
Hmm.
is a very tangible thing that we see, right? Like if my peers see me eating too quickly, that's very noticeable. It's not, like stimming that you can kind of mask to a point. Um,
Hmm.
or like sensory sensitivities that you can kind of just like shut yourself down and hope for the best. Um, Also at that point in the day, like by the time lunch came, I had already been shutting down my sensory sensitivities for 3 to 4 hours. So I was not very primed to go into that meal, like listening to my body. So
Hmm.
there's that aspect. And then there's also the aspect of I don't want to have one more thing that's different between me and my peers. So even if I don't like this food that I'm eating, this is what the like this is what the typical person is eating for lunch. So I'm going to eat the same food, even though I would much rather have something completely different. Or like one time, I had a friend say, like, why don't you drink like just like a water bottle like the rest of us do? Like, why do you always have this like flavored water, like juice stuff? And I was like, uh-oh, can't do the flavored water anymore. Not can't happen. Because that is weird. That is different. I cannot have one more thing be different about me than my friends.
Hmm.
What if my friends disown me? Then I will be alone in this thousands of person school, and that would be even worse. So I better not drink this water. So I think bringing that into eating disorder treatment, if a teenager is like, I can't bring my favorite food to school or whatever it
Hmm.
looks like, or I can't have breakfast or my AM snack at school, it's like, why?
Hmm.
And if they're able to verbalize like, yeah, it's because I don't want to be different. Or if they're able to verbalize, like, I don't want, like, my friends might think I'm fat if I eat during class. Um,
Hmm.
it's like, okay, yes. And is there something more going on with that? Like, your friends might think you're fat, again, using that word with quotation marks. Um, but what does that mean? And like really digging into that under context of it, subcontext,
Yeah.
we got there. Versus it just being that's your eating disorder, you need to nourish yourself, have your
Hmm.
snack, here's your carb, here's your protein, go for it,
Hmm.
eat it. And then we're just setting them up for failure because we haven't actually gotten anywhere.
Right. You're working with the person and understanding what's behind the behaviors instead of just labeling it.
Yeah. Yeah. And I think coming at it with like the understanding that like there there's probably something more going on here. Like I think
Hmm.
traditional eating disorder treatment sees it as like, oh, they're afraid of gaining weight, like they don't want to be different than their peers because they're afraid that they're gonna gain
Hmm.
weight and then that's gonna make them different. And it's like, but they might already have everything else making them different.
Hmm.
And that's one more thing. So not assuming that they're neurotypical, even if they might be coming into your office without any sort of autism diagnosis or ADHD identification or anything like that.
Yeah. Not assuming that the rules we made to fit whatever is considered the norm are going to fit every person who walks into treatment or walks into your office.
Mhm. Yeah.
You had started talking a little bit about your own experience of masking, and if I understand correctly, you have eating disorder recovery experience as
Hmm.
well.
Oh yeah.
Okay. And I hear you alluding to a process where both with your autism and with eating disorder, like you've moved through very much shutting down parts of yourself or trying to hide them to getting more in touch with both yourself and your body. Can
Hmm.
you share that story to whatever extent you feel comfortable?
Yeah, yeah. I think that as autistic people, we really are masking from birth. Um, in a lot of ways, right? And RDs for Neurodiversity talks about this a lot, just like in her trainings, but um how we're taught to comfort babies by holding them and hugging them and swaddling them. But if that is not our way of dealing with our nervous system or
Mhm.
coping. Like that's a parent is told to do that, so they do that anyways. But then we just learn to shut down as babies. Like kind of think of the
Mhm.
like infant that was put in like the cry it out method because
Mhm.
the parent never came. But like if the particular comfort that we needed never came, we're still basically in the cry it out method where we just learn to
Mhm.
stop crying because what we need is not coming. Um, and so I think that that can be very true. For me in particular, I had selective mutism. So
Mhm.
I was hyperlinguistic, and speaking in like three-word sentences, which could have been some of the gestalt processing. Like they might not have actually been sentences, but to everybody else they were. Um, at the on my first birthday. But when I went to daycare and preschool, they were like, "No, Brenna doesn't know how to talk yet."
Mhm.
No, sorry, she doesn't talk. Yeah, like she's and then of course my mom would be like, "But she talks my ear off at home. Like she's talking all the time." Um, and I don't think that I necessarily knew what was going on like when it was that little.
Mhm.
Um, really, I mean, I'm still have selective mutism in like some circumstances. Um, but I think that there was that like first push for whatever reason of like I need to shut myself down. Like I have something to say, I have something to do, but like I cannot say it. Like when I was little, I thought that there was something like physically wrong. Like I thought that I had like something wrong with my vocal cords because I could not get the words out even if I wanted to say something. Um, so there's this an internalized feeling of like there is something wrong with me. Like I am the wrong one. I'm not strong enough to deal with the beeping sound that's coming from the smoke alarm. I'm not strong enough to deal with the bright lights, to deal with the sweater rubbing on my arms or the, whenever you get to junior high, like the
Mhm.
underwire of my bra poking into my ribs. Like, and then everyone's like, yeah, bras are uncomfortable. It's fine. And it's like, no, 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 no. Like this is 24/7. Like I literally want to cry. And like this is a bad thing. But we learn like, oh, it's just uncomfortable. Okay, I just need to tough it out. I need to be the stronger person. I need to be better. And then I think we transfer that with our food, right? Like, and especially with like self-soothing food behaviors. Like if we are stimming on texture or taste, then we're also told like, oh no, don't eat too much of that. Have a
Mhm.
moderate portion. And it's like, okay, we're not eating this like for food at this point. We're stimming, and that is also a valid and okay thing to do with food.
Can you tell me about what all that was like for you personally?
Very isolating, and it really has been in the past, let's see. In 2020 is when I was able to like fully identify that I'm autistic.
Mhm.
Um, and so really the past 5 years, and I think I'm never going, I mean, like in this, if other people were to define it, yes, I'm recovered, but I think for myself, it's going to be a lifelong journey of like rediscovering myself, rediscovering who I am. Um, there's never really going to be a like, yes, this is myself because I'm also still dealing with like, professional situations and having like severe anxiety before that. And like, how do I cope with that? And um, yeah, what was the question? How that was like for me. Um,
Yeah. When you're talking about people with autism and eating disorders, you started talking about how sometimes eating can be stimming or the types of eating behaviors you develop. What what was that all like for you?
yeah, yeah. So I think that this is where it can get a little gray, and this is why it's important to be like neurodivergent informed, because I think it was, especially in like high school, a big part of it was that binge restrict cycle. So I would
Mhm.
restrict food at school because I didn't want to be weird. Like I wanted people, I was already chubby. I'm not skinny. I will never be skinny. Even when I was severely malnourished, I wasn't considered skinny. But I was chubby and I didn't want people to see me eating at school. So I eat
Mhm.
just enough. I think
Mhm.
everyone that has had restriction knows kind of figures out their just enough point to where they're not scrambling, but definitely not enough. not enough. So then I would come home from school and I would binge eat and it would feel good. And I don't think that
Of course.
feeling good about it needs to be demonized. And at the same time, it was a byproduct of I was so sensory overwhelmed at school that I needed something to
Mhm.
help bring me back down to earth.
Yeah.
And I didn't know anything about like deep pressure therapy at that point. I didn't understand any of like proprioception stuff. So having a full stomach felt good. It felt similar to like what a weighted blanket would feel like or what like deep pressure therapy would feel like. Um, and in a lot of ways, I'm very proud of myself that I figured that out. I figured out what felt good, even if that wasn't what society deemed as good.
Hmm. Well, that's so interesting. So you have the restrict binge cycle, which there is a kind of comfort in finally eating after you've been deprived for a long time. And alongside that, there also is a sensory component of it feels comforting to me to for me to feel my stomach full. It's grounding after a full day of hiding myself.
Mhm. Yeah, yeah. And for me, I'm very much a physical stim person. Like it's so it like mind boggles me that I wasn't identified autistic earlier because I was doing the hand flapping, the stimming, like the rocking back and forth, all of what we consider to be autistic. And my mom was like, I think you just have Tourette's. I think you just have Tourette's. I don't have Tourette's. I'm autistic. Um, so for me, it was very physical. And so that was a way to kind of have that physical stimulation that wasn't hand flapping because my dad would be like, why are you doing that? Why are you shaking the remote around? Because also I really like to see like, the little light on the remote like they had in the
Yeah.
early 2000s. I like to see it spinning in a circle. And my dad was like, if you're shaking the remote around, you're going to break it. Like you don't shake technology. What are you doing? And I'm like, well, that's so cool. So I'm like, I can't do that anymore. Dad will yell at me. Um,
Mhm.
but I can eat these crackers or
Mhm.
chips or Cheez-Its or whatever and have that same physical, like deep pressure sensation, um,
Mhm.
and not get yelled at. So go
Wow.
me for finding something.
Yeah. And you can look back at that now and appreciate why you did it and how it helped you.
Yeah, yeah, absolutely. And I think early on in my recovery, it was like that's part of your eating disorder, which
Hmm.
it definitely was part of the binge restrict cycle. And there was also this like really
Hmm.
awesome, empowering thing that I was able to
Hmm.
accommodate myself,
Hmm.
even if it was using like what other people would label as disordered eating behaviors, there was a very like it's very healthy to seek stimulation. It's very healthy to stim for an autistic person. So
Yeah.
that in and of itself was a healthy behavior for me to engage in. It's just that I had all these other barriers that prevented other ways of stimming. So I found what I could find. Um,
Yeah.
yeah,
Yeah. And if we were to attempt to take that away without understanding what was underneath it.
exactly. Exactly. Yeah. And I think I feel like I almost had like two phases of my eating disorder recovery. It was like the nourishment phase. And then I was like, wait a minute, wait, what are we doing? And I mean, I feel like it's very taboo and I don't know, maybe I don't want to say this on the internet, but I'll say it anyways. I feel like it's very taboo. Like you need to be whatever they label is like 1,000,000% recovered. But I feel like once I got into the eating disorder treatment field, I was like, this isn't right. Like, so I feel
Hmm.
like then I almost had to unmask what I had learned about like what was true proper eating. And I'm like, okay, how do I need to eat for myself, like to fully like self-actualize as my autistic self? Because I'm never going to get there if I'm
Hmm.
not embracing my autistic brain. So you kind of have to I had to relearn what it looked like for me.
Hmm. Yeah.
Yeah.
When you were in what you describe as the nourishment phase, was that in a treatment center or what kind of setting were you in? What was your experience of that?
No, which a big aspect of that was just lack of resources. Like there weren't really any outpatient providers that took my
Yeah.
insurance. I didn't go the treatment center route, which at this point I'm really glad that I didn't, just kind of
Hmm.
knowing my autistic clients' experiences
Yeah.
there, I think that it would have just traumatized me even worse.
Mm.
Maybe it wouldn't have, but I think it would have. So I really just leaned a lot into community support, into family connection, a little bit of like spiritual support. Which again, I think is kind of taboo for us to say like we didn't recover in the traditional sense. And it's,
Mhm.
you know,
Yeah, I'm actually with
it's
you
what
on
it
that.
is. Yeah.
Yeah, I'm recovered from bulimia, binge eating disorder, also on my own
Mhm.
or outside of treatment settings, mostly through like reading books.
Mhm.
Um, so did that because you were recovering outside of treatment center? Do you feel like in retrospect that gave you more space to work through things on your own or like work through things in ways that worked for you personally? Or was there still just a lot of expectations around it that
I would love for there to be a treatment center that is more neurodiversity inclusive. I think that that would have been fantastic for me to be able to just have a break from my daily life, and just
Mhm,
really focus on my recovery. And I mean, not to say like every single autistic person leaves a treatment center traumatized.
mhm,
And I do hear it more often than not, where we're
yeah.
then like, yeah, they're nourished, which is fantastic. And now we also have this additional
Mhm,
bag of trauma that we are now having to unpack, um,
yeah.
like later on in their recovery.
Mhm,
And that can also lead them to not seeking treatment sometimes. Like I've had some that
yep.
will have
Same.
a gap in treatment and then they're like, I don't want to go back to res, so I'm gonna try you out. I'm really scared though. And it's like that
Mhm,
sucks that you felt so othered by a treatment center that you didn't seek step down care. Um,
mhm,
so yeah, I'm
yeah.
sure that there's a universe where I did go to treatment and I don't know what she's doing in that universe, but
Mhm,
I'm glad that I am here in this universe.
yeah. Yeah. When you were in your like first experience working at a treatment center and you're seeing these things that feel kind of off, what what was communication with like? And you were new there, so I imagine it was probably difficult to communicate or advocate for something different at that time.
Yeah, I mean, I was still like I was 21. I was a diet tech. Like I was very much like these people know more than me. I'm going to listen to these people, and I think that that's also taken a lot of work of being like, how do we know that? How do we know
Mhm.
that they're smarter than me? Especially when it comes to autistic people. Like if we're having neurotypical people speak for autistic people, that kind of sucks. Um,
Mhm.
yeah. What was the question? Sorry, ADHD. I like to go off on tangents.
I feel yeah. So when you started in that tech position, you didn't really have a lot of space to advocate or to speak up what you were feeling or seeing.
Hmm. Hmm.
As someone with autism, like you were new, you were young, the people on top of you presented as the experts, and you're like, okay, they must know.
Hmm. Exactly. Yeah.
What was the turning point for you when you started to feel like, hey, there's actually something here. I'm actually onto something that I've experienced and that I'm seeing clients experience.
I think there wasn't necessarily one turning point.
Mm-hmm.
Um, but I did know that just something felt off.
Mm-hmm.
Something just was not meshing with me. Something was not vibing. Um,
Mm-hmm.
for the whole time. And I think once I got to that point where I was like, okay, I'm about to like submit for my SEDS, like I am technically as knowledgeable as those supervisors, back in like 2017, like
Yep.
as those supervisors were at the time, and this still isn't right. Like this is not just me not
Mm-hmm.
knowing yet, like something is actually wrong. Because
Mm-hmm.
I know theoretically, enough to be considered one of those people now, but it's
Right.
it's not right. So it's not just the material, like something is lacking.
Mm-hmm.
Yeah.
Yeah. So as you build your own like professional credibility, you're like, okay, this is not just my lack of expertise.
Hmm. Exactly. Yeah.
And at that point, did you start speaking up about it, or what did that look like? What did it start looking like when you brought that to what you were saying more loudly?
Um, yeah, that was a whole journey in and of itself, just because I didn't want people to feel like I was disrespecting them or saying that they were wrong. I didn't really want to start shit in the community, like I didn't want to be abrasive or rude.
Mhm.
And I think too, just like still dealing with selective mutism, like I'm gonna have that. That's part of my autism. It's not going anywhere. It's hard. It just gives me another layer. Um, and so I didn't want to say too much, do too much. And I think at this point, I'm like
Mhm.
having been in private practice for 3 years and working from a neurodiversity affirming standpoint, um, and seeing how much healing, like not just like
Mhm.
like we're not just checking off a checklist here, but like my clients are healing, they're
Mhm.
presenting like they feel more of themselves.
That's me.
I'm like, this is not something that I can really stay silent about because I know that there's fellow autistic people that probably don't even know that they're autistic yet that are still saying, "Oh my God, it's just my eating disorder that's making me eat the pizza crust.
Yeah.
I just need to stop binge eating. And if I just ate X, Y, and Z, then I would stop binge eating and I would feel better. And why can't I do it? Oh my God, I just suck. I'm such a terrible client that I can't get this figured out." Um, and we're just really missing that big aspect that's, hey, you're probably autistic. Um,
Mhm.
because we're so highly masked, or a
Yeah.
lot of us are so highly masked that um we miss it and we don't think to look for it. Um,
Yeah.
yeah.
You've had some powerful experiences with clients, seeing that a neurodiversity affirming care or understanding
Hmm.
their autism was helpful. Can you, I know you can't share like specific client details, but can you share sort of like a, I don't know, like a mix of those stories, or share a story that it doesn't have to be particular
Yeah. Oh
about
my
your
goodness, there's so many. I mean, I have had a client that was looking for treatment for years, but was identified as autistic, and would just straight up get turned away because the dietitian was like, "I'm sorry, I don't work with autistic people. I don't have that expertise." Which on one hand, I'm like, thank you for not screwing us up. If you're not willing yet to do your unbiasing work, and like your radical acceptance work, thank you for not working with us. On the other hand, I'm like, that really sucks that they didn't have any access to care. Um,
Mhm.
so that's one experience. Um, and another one is like the client did take a long break from residential care to outpatient care. And they were someone that was like one of those revolving doors with residential for a little while,
Yep.
um, because they felt a lot of shame for their food choices. And I think hearing it right off the bat, like we'd be like, no, yeah, that's your eating disorder talking. But I'm mishmashing here. I'm not using their like preferred food, but one of their like hyperfixation foods was something akin to like oatmeal with cheese and Nutella,
Mhm.
which I think most of us dietitians would be like, that's disordered.
Mhm.
You're eating that because you X'd many things off, and that might be true, but also for this client, they're eating that's carbs, protein, and fat. Like we're good. That is not our top priority. And once we got into it, they're like, it feels very satiating, it's salty, it's sweet. And I'm like, and then from that conversation, we're able to go into, okay, you like things for breakfast that are salty and sweet and satiating. Are there other
Mhm.
foods that maybe your anorexia voice is not allowing you to look at because it deems those foods as bad? We can still keep your oatmeal with Nutella and cheese. And are there also other things? And so from that conversation, using what they like, versus just saying, no, that's disordered, let's find something else. Then we kind of miss out on this whole topic of what they like about that food. Um, yeah.
Yeah. So you're not immediately judging a food as disordered, which, like, as I'm thinking about it now, I'm like, whatever gives us the right to
Yeah.
decide that a food is disordered, other than that the person is not adequately nourished? And are there ways of working with that? So instead of being like, okay, this is disordered, it's like, can I understand what you like about this? And then from there, you're able to expand into
Yeah.
bringing in other foods that they enjoy, but maybe aren't allowing themselves.
Hmm. Yeah, exactly. Yeah. And I think
Mhm.
a lot of us present in treatment as very like, are we, what note did I write down? Are we conforming or
Mhm.
are we healing, especially with like ERP? So a lot of like I think
Mhm.
whenever we think of our autism and eating disorders, we think of ARFID. Um,
Mhm.
we definitely have all the other types. But with ARFID, there is like in other, group conversations and stuff, people are, like I kind of said before, very scared to be in cahoots with the eating disorder. So much so that we're not considering that it's autism. So like there's one client that um extremely malnourished with ARFID when she was really young, like prepubescent. Um,
Yeah.
went to a treatment center, so highly masking, you would not know that this kid is on the spectrum whatsoever. She's
Mhm.
very highly masking. Um, so she went to higher level of care, like she went to inpatient residential, um, and they were like, "Oh no, not autistic. So we don't need to make any accommodations. Check, not autistic." And so
Oh.
they treated her with ERP as if she wasn't having all these sensory things going on. And so they'd present her these, she had like ARFID and emetophobia. They'd present her with these exposures of like, looking at other people's like pictures of vomit or whatever. And she'd be like, yes, yes, that's correct. I think that they eat cereal. Yes, ma'am. No, ma'am. And they're like, yay, she did so great. She didn't have any of her symptoms, like any of her like ARFID reactions during this exposure. Awesome. And then she gets down to me and she is so highly masked that she's so shut down from herself. And then as we're
Mhm.
working out, I'm like, now this is 5 years later, so she's a teenager and becoming a young adult. And I'm like, what do you want? Has anyone ever asked you what you want? Like, are you at all invested in your recovery, or are we just kind of steamrolling and saying, yes, this needs to happen? Which I think for
Mhm.
teenagers and like, yeah, I don't want them to grow up and have osteoporosis or
Mhm.
terrible things that we know can happen from malnutrition. So I'm not saying
Yeah.
don't do the interventions to get them nourished.
Mhm.
And now that we've really had space to breathe and say what's going on, now we're like, oh, she's autistic and she's been masking for 5 years straight.
Mhm.
What do we need to kind of take apart so that we can pick up this
Mhm.
whole piece that we've really been overlooking because she's not stimming like we think an autistic person would stim.
Yeah.
Um, yeah.
And what did that look like, or what kind of shifts did you make based on knowing that?
I think that that's scary to bring up with a family,
Mhm.
especially if you've been working with a family for a long time, right? Like you don't,
Mhm.
it can feel very out of left field, but I was just like, and after they go on, they went, she was relapsing, struggling hella hard again. And I'm like, have we considered autism? And the family
Mhm.
was like, well, we just always thought that that like wasn't something that was part of her because she just like doesn't seem autistic. I'm like, I kind of think that we need to think that maybe is this why she keeps is
Mhm.
this why we're not really getting to a place of like stability? Is
Mhm.
maybe we're missing the fact that she's not neurotypical and we keep doing these exposures,
Mhm.
getting somewhere on the surface, right? Like she can white knuckle through an exposure,
Yeah.
great. But we're not helping her nervous system acclimate with whatever trigger is going on
Mhm.
if we're white knuckling, if she's just shutting down and if she's masking. Um,
Yeah.
so having those really tough conversations and then as a dietitian going to the therapist and being like, hey, we talked about autism and that
Mhm.
technically is outside of my scope of practice, but I did it anyways and we need to have this conversation. Um,
Mhm.
yeah.
There's so much more I want to hear right now.
Yeah.
I'm in the library study room now and getting kicked out. So we got to wrap up. Um, just to sum up like, if there were a couple of messages or things that you want um, me and other providers to know when working people with people on the spectrum, can you share what messages you want to leave us off with?
Yeah, I'm looking at my notes. Um, Clients are not going to come to you and say, I'm autistic and I have all these sensory issues. They're going to be shut down probably since the point of birth about that.
Hmm.
Um, Highly masking autistics are more likely to get diagnosed with personality disorders, depression, anxiety, sensory processing disorders before we ever get diagnosed as autistic. Um,
Hmm.
I also really want to make sure that are we using neurodivergence in the broad umbrella of things, which technically would include eating disorders if we're using the true neurodivergent
Hmm.
definition, or are we just using a euphemism for autism?
Hmm.
Because those are kind of different things, can be applicable to each other, but they're different.
Yeah.
And are you helping your client conform? Are you trying to promote conforming, or are you helping your client heal from
Hmm.
their disordered eating?
Yeah. Awesome. Thank you so much, Brenna.
Yeah,
I
thank
really wish we have
you.
time because I have some pressing questions, but we'll leave it off here.
Yeah, this was
So
fun. This was not as scary as I thought it would be, so that's good.
awesome.